Welcome back to In Your Neighborhood. I'm your host, Sharla Brown, and on today's show, we've been talking with the NorWest Community Health Center. My guest today has been Anita Jean. She's the manager of health and social programs. And we were talking a little bit about social determinants, and I'd like to ask about health equity. And is this an emerging concept?
You could call it emerging concept because we're paying more attention to it now. So health equity is realizing that certain groups, certain populations are not, they're disadvantaged essentially. And so you might need to invest more resources up front to make sure that you reduce those barriers, those inequities. You look at, for example, if you are a young first-time mom or young mom, usually you don't have all the resources to purchase everything that you need or you feel you need. So the concept of a baby box, so that you have a place to put your infant to sleep. So this gorgeous baby box comes with a mattress, some supplies, a lot of information, and also will promote things like breastfeeding. And it's available to anybody who asks. So this way, it's not just poor people that get it, right? Mm-hmm. So this, it's like having new toys, you want to use them, right? Mm-hmm. So when we look at how we treat folks with mental health and addiction, the new Syrian refugees, people that might be marginalized, folks at shelter house that we interact with, if we have some ways where we are conscious of the barriers that they may be facing, the traumas they've had before, and we take our time in terms of orienting at time of intake into our care so they know what to expect, that we have supports available for them via the community health workers, that we can do things like ID clinics so that people can sign up for a birth certificate, and it's free of charge because of our partnership with Kinewa Legal Clinic, mm-hmm. for example. All of this work that we do with partners in terms of we're recognizing that there's inequities that will affect health outcomes, and just essentially building the supports as part of our services. Mm-hmm. So in terms of awareness of that, I think it was already there. Like you do the supports like bus passes, and then the snacks or the food that you serve at programs, that you provide childcare when you do something in which involves parents. But now we're calling it health equity, trying to even the chances for everyone to have good health.
Absolutely. And I think that it's a beautiful holistic approach, that it's not just the tools, so say maybe the baby box, but also then the support and the education that comes with it. So maybe it's the programming that goes with it, how you use the things that's in the box. Mm-hmm. You're creating a healthier mother, you're creating a healthier baby when you can promote things like breastfeeding, mm-hmm. and it's an amazing approach for sure. So it's great to see that you do that kind of work over there. Now, you've got a big organization over there. Mm-hmm. I'm curious as to who's all part of your multidisciplinary team.
It's wonderful. You essentially get access to the services that you need. You come to us and you're fairly healthy, so you might be assigned a nurse practitioner. If you have conditions that warrant it, you will be assigned to a physician. And nurse practitioners and physicians will always be able to consult because they're right part of the team. You have access to a dietitian, you have access to a nutrition worker in terms of preparing programs for food for people to learn how to eat healthy. You have therapists or counselors. You have access to psychiatry. We have nurses. We have foot care nurses. We have a wonderful admin team. We have essentially everybody. You see who you need to see. You can have internal referrals, and so that's available for the primary care clients. For anyone in the community, you need to have to access a walk-in for things that are not urgent, that you wouldn't go to the emergency department for, right. Like colds, cuts, sexual health, birth control, things like that. You can come to our walk-in clinic. Anyone in the community can come to the walk-in clinic, provided that they have a health card.
Wonderful, and that's good to mention that, because a lot of people are always looking for a walk-in clinic, and you're also open on weekends.
Yeah,
which is
Saturdays and
important.
Sundays. I think the core hours are 10 to 3, but it changes. It may change, so I would recommend folks to look on our website.
Yeah.
We update the website frequently and post the walk-in hours there, or other services and things that we're doing.
Wonderful, wonderful. And let's talk about, who's able to come and use the services at NorWest Community Health Centers, and kind of what that process is to kind of use the services.
We have this request for service, so that it's a paper form that people will fill out to apply to be accepted in our practice. So that they're assigned a physician and nurse practitioner. So there is a process for that. At times we might be not accepting new applications because we need to have those trickle in. Although we're pretty much accepting new clients on an ongoing basis. So folks just need to get in touch with us. But the access to the urgent care or the walk-in clinic is at any time. For folks that need some supports, like finding out about services in the community, being help with navigating the services in the community, or even our own services, we have what we call community health workers. So community health workers are navigators, client navigators, and also health coaches. You don't need to be a client of the center to come and access one.
Great.
You may need to have, for example, we will host ID clinics for people to have birth certificates. We will have programs, drop-in programs that anybody can access. We will also have folks that call us, they're just looking for things like services for mental health. So we have some therapists, but they're for our primary care clients. But where else can you go in the community? Things that they need to have access to, but they don't know. We're a good source of information for that.
That's absolutely wonderful. And let's talk a little bit about the outreach services.
We do a lot of outreach. So like I mentioned earlier, we have about 25 points of access when you figure the main sites and the mobile services and the outreach. So we do regular outreach weekly at Shelter House. We're at Balmoral Center at the Detox. We're also at Creighton, and we also have some programming at Asif Court and at Limbrick. We'll do weekly walk-in there. So depending on the location, depending on the service, you may have a nurse or nurse practitioner. Usually there's, some of them is community health workers, more program-based. And the best thing to do is, again, check our website to see where we are, what we're doing, and if there's any interruptions in service. For example, if we have like vacation or holidays are interfering with the schedule.
And that's great for anybody who has transportation issues, that there could be something closer by for them to be able to attend, or somebody that they can at least talk to and ask a question to. Wonderful. So let's talk a little bit about the fetal alcohol syndrome program.
Okay, a fetal alcohol spectrum disorder. It's called different names depending on the source. So FASD is when the baby has been exposed to alcohol consumption when mom was pregnant, and we didn't know that 20 years ago, right? Or sometimes they say now, half the pregnancies are not planned, so it is quite possible for someone to drink while they're pregnant without knowing they're pregnant. So there's no safe amount of alcohol while you're pregnant. It may cause a permanent disability that will vary in severity. So some folks are not very strongly affected. Others, it's essentially a serious disability, and they will have a lot of difficulties coping with life. So, just being able to hold a job, being able to understand consequences of their actions so they get in trouble with the law. So what we have is a diagnostic clinic. We have one of 14, approximately 14 active diagnostic clinics in the province. We're one of the few that will diagnose through the age, so either from children to adults, and we will have support for the individual and family members while they're going through that. Because usually they come to us and they're in a state of crisis. And what we're trying to do is rule everything out that could explain it, so that by the time the diagnosis is made, there's no doubt about it. So the diagnostic rate is approximately 80% of the clients that we are seeing at our clinics. And we have a physician, nurse practitioner, and a community health worker as part of the team. There's the FASD coordinator, Maureen Parks. So we run a monthly clinic, except for I think August and December, but we're essentially always accepting referrals. We work with partners. There's other diagnostic clinics in the province, so we're making sure that folks that are coming to us are most appropriate, and we're not like, for example, there's one in Kenora that will diagnose youth. Right. So we're having good relationships in terms of client flow to the most appropriate source. We will also work with a lot of service providers to do a lot of education and training. We do a big training event usually in September with an expert that we bring in town. And we'll do a lot of awareness campaigns as well. And we'll do caregiver programs. So it is not always the parent, but sometimes it is the partner of someone that's going through the diagnosis or been diagnosed that needs to see how, some strategies in terms of dealing with the individual with FASD.
Absolutely, absolutely. Well, we're going to take another quick break. We're going to be right back with Anita and talk more about the NorWest Community Health Centers.